Not exactly a blue sky, is it? But hey, it's 11:11 here on 95.1 Nigeria Info. Your number one topic to talk about. And we kickstart the conversation today around persons who are living with HIV. And
a sunny weekday morning in Kuruduma, also known as One Man Village, a densely populated community just outside Nigeria's capital city, Abuja. A group of sexual reproductive health rights advocates from the International Community of Women Living with HIV, ICW West Africa, has come for a sensitization meeting on sexual reproductive health and rights of women and adolescent girls with members of the community.
I know. That's the way they say, now woman be this, is your right. So just say after you, my body, my rights.
My body, my rights.
My womb, my rights.
My womb, my rights.
My sex life, my rights.
My sex life, my rights.
Only the woman can decide how many children she wants.
The meeting holds at the palace of the village head.
You can imagine I'm a man. I've gone to bed with all the discharge in the night. In the morning, I'll just continue to do work. I'll not back. You are just inviting bacterial infections and so many things to the family. And again, when you expect your husband to come and make love, you just think about the odor that she used to perceive. And when you think about that odor, that man will never come again.
They freely discuss issues ranging from personal hygiene, family planning, to the critical role of parents in guaranteeing good sexual and reproductive health for their children, as well as the duties and responsibilities of healthcare and other service providers.
As a woman, you are married and you prepare your mind to have sex with your husband, and for one reason or the other, that sex could not happen that day. How will you feel as a woman?
You feel bad that very day. Then you have to go and meet him, ask him whether that is no strong, whether you need to ask him why you not want to do that very day. As a woman, those days when we grow, our parents, they not go school.
The people of One Man Village hardly have access to health education like this. There is no standard health facility in the community. This is the only health care center here. A 4-room structure manned by just one nurse and a birth attendant.
We're supposed to have family planning section. We're supposed to have labor room, consulting room, injection room, but we don't have them enough. We are just managing the rooms.
The story of poor health facilities and lack of access to health education is not peculiar to One Man Village. It is common in most urban settlements and rural communities in Nigeria. The International Community of Women Living with HIV, ICW West Africa, recognizes this as a major threat to the huge successes recorded by donor partners and the Nigerian government in the fight against HIV in the last decade. This prompted its campaign on access to non-discriminatory and non-coercive sexual reproductive health and HIV services in some parts of the country.
It's like a pressure group comprises of women and young girls living with HIV, including also young women and men also who are not also HIV positive. So okay, we're going to call it She-We Coalition, so representing the female face to actually advocate more for SRHR in terms of family planning, access to family planning. Even when you are not married, you have a right to receive request for family planning. If I'm not married, I have a right to say, oh, I don't want to have a baby now, and I deserve to have a condom, or I deserve to, anything that will make me not to get pregnant, I deserve it, but our own society does not allow that. So that was what the She-We Coalition was actually doing in Ondo State, Lagos, and Abuja and Nasarawa State all together. So when the Women Global Network and ICW Global, the project ended in the end, Amplifying Change now said, oh, we want to continue with it, since this is having a multiplier effect.
One of the strategies also to identify the facilities where issues are coming from in terms of issues of stigma, issues of discrimination, so that the evidence that we collect that have been collected, we use that evidence as a tool to engage with the care providers, to sensitize them and to see how we can better the life of women living with HIV, or how we can better the services that they are receiving in those health care facilities.
ICW is a global organization, but it has regional and continental chapters. Yeah, the chapter for West Africa is the one that we're quite familiar with in Nigeria, and we have collaborated with for a very long time. Their interest is a particular interest within the scheme of resolving the HIV challenge, and that is young people. What is their reproductive needs? What are their sexual health needs? And how can you be able to respond to them in time so that they don't become infected? And if they should become infected, that they're quickly diagnosed so that those who are in the way of having a baby can also be protected along with their baby. So the interest that ICW pushes in Nigeria, in West Africa, is very key, because if we are able to actually reach young women and girls early and protect them as they grow through the life cycle of life, we actually will be ahead in the fight against HIV.
Over 540 kilometers from One Man Village is Imafo, a community in Akure local government area of Ondo State, southwest Nigeria. Another group of Shiwi Coalition members of ICW West Africa is on duty. Again, the Shiwi Coalition members are here to sensitize women and girls of Imafo on their sexual health and rights.
Children, especially female ones, they should not have sex until they get married. That is our expectation, isn't it? But I want to ask you a question. Is that happening now? As a parent, if you talk to your daughter about pregnancy, about how she can take care of her body, about sex, that will not make that your daughter to go out and start to look for men.
The Shiwi Coalition Network members do not only carry out their advocacy and sensitization in the communities.
There was a time we went for a radio program. So we were talking about girl rights. Girls have rights to their sexual health. Girls have rights to make decisions on their own, when to get married and when not to get married. So a call now came in and was like, why are we educating and poisoning our young girls towards the men, especially in the northern area, that they like them virgin? So to my surprise, somebody again called, a girl called and said because of the culture that binds them makes her to be having sex through her anus. And because of that, that thing has caused a lot of problem to her, that she's not comfortable anymore. That because she wants to marry as a virgin, because it's a taboo that for her not to marry as a virgin. So with that, she has to protect her virginity and be having her sex through her anus. That what we are doing, that is good for them, because I wish she got the information earlier, she wouldn't have been in the mess that she is today. So this program has opened a lot of young girls' eyes, especially young people living with HIV and AIDS.
They also campaign at healthcare facilities against stigma and discrimination faced by women and girls living with HIV and encourage individualized client-centered care. A primary health care center in Maraba, Karu local government area of Nasarawa State. It is antenatal day here.
So, sexual reproductive health is a very critical issue.
The Shiwi Coalition members have come to meet with pregnant women and their care providers.
Girls contribute to the 30% maternal deaths every year. Why? Because some knowledge about sexual reproductive health is not gained by that population.
Some that takes implants, immediately the time they implanted it to elapse, once it elapses and they decide to remove it, it will take them maybe some months or a year before they take it. So what could be the cause?
Thank you. You know, family planning nowadays is different from before. Now, the family planning, we are even encouraged like 15 years old in order not to have unexpected pregnancy. The family planning now, immediately you stop taking it, you will be pregnant.
The meeting continues with healthcare professionals who give information on the challenges they face in providing services.
It has to do with religion. Most times the Muslim women cannot come out for family planning. They don't come out for antenatal. They are always in their houses. Even the delivery, they always like to deliver at home. But with the awareness going on, at least there is improvement. You can see young girls are coming out for family planning now. Even the married women, with the consent of their husbands or not, they come out for family planning. In Abuja and also Lagos State, we have achieved a lot because the way young people is being treated before, it's no longer like that. In some of the facilities now, young people will go there and request for condoms. And even when they have not requested, the condoms are available for them to have access to it. But it was not like that before, because they see it as a taboo. That for a young person, maybe like 18 years, should be asking for condom, or less than that, should be requesting for condom, or family planning. What are you doing family planning? Because it is believed in our own culture here that it's only married people that are qualified for family planning, but it's not true. And all those have been achieved.
A critical area of the Shiwi advocacy is access to safe abortion services. In Nigeria, abortion is illegal, and this is believed to contribute immensely to the huge number of women, especially adolescent girls, who die in the hands of quacks every year.
Whether you like it or not, as I'm talking to you, abortion is taking place now, somewhere in one of the quack, and they die. So that is where we are putting from the human rights aspect of it. Why can't you make abortion this? Because you know that this thing is happening. So why pretending about it? But meanwhile, why we respect the law of the land as a country? We also advocate the issue of family planning, because it will also prevent unintended pregnancy, because we believe that every pregnancy is wanted. Understand? According to UNFPA, every pregnancy is wanted. So abortion is not an option, but we can also prevent unintended pregnancy. So we advocate for that, we educate our women for that, and even health workers will educate them to allow these women to access family planning.
The challenge of unsafe abortion is a major national health issue. Worse still, it complicates care for women and adolescent girls living with HIV. This forms a major part of the Shiwi advocacy at health institutions. An example is the visit to the outpatient clinic of the Nigerian Institute of Medical Research, NIMR, in Lagos.
For many of those adolescent girls and women living with HIV, when they get pregnant, the pregnancy actually is intended, it's planned for. But along the line, maybe their health deteriorates, like issue of mental health comes in, and other issue may come in, and they decide that, oh, this pregnancy has put me at risk, put my health at risk. I say, with this, it is for you now to go to the hospital and engage with your doctor, not to go to quack. Because this is what the law is saying, that abortion is legal to the extent that it is done to save the woman's life.
If you provide family planning, you do proper counseling, that actually in the long run, the cases of termination of pregnancy goes down. Because what normally happens is that when you introduce wholesale termination of pregnancy without the preventive components, without the counseling component, that's where what we are afraid of happens.
We need to talk to our young people about sexual reproductive rights. We have some cases that we can share when we are taking this discussion. We have some young people that they are in the point of death due to abortion. And that's when we see that most of them have a lot to think about. They feel that my parents want me to go to school. So if any pregnancy occur, whether you like it or not, the next thing they are thinking about is to abort it. No matter if you get to know safe, it may be at the point of death or when the womb has already packed up, that's when you will know.
The positive impact of campaigns like this one on the fight against HIV is tremendous. For instance, the outpatient clinic of the Nigerian Institute of Medical Research, NIMR, has recorded a milestone in the prevention of mother-to-child transmission of HIV.
When pregnant women take their drugs, they are virally suppressed, their children don't come down with HIV. And in the last 1 year, or even more than that, we've not had a single case of a woman who went through our PMTCT service and the child came down positive. So that's something to celebrate.
There is so much more to celebrate in the fight against HIV and AIDS in Nigeria, and representatives of government bodies, international partners and non-governmental organizations attest to this.
The number of people living with HIV/AIDS in Nigeria are not up to 3.2 million that we have thought in the past. They are actually below 2 million. So now we are working with a number that is within the range of 1.8 and 1.9 million people living with HIV/AIDS. The good thing is we've identified up to 1.1 million now. They know their status, and majority of those are on treatment and they are sustained on treatment.
Without a doubt, Nigeria is part of a global success story. We are winning the war on HIV. The target that was set for HIV is to reverse the trend. We've been able to establish it, and Nigeria is part and parcel of that global effort to reverse the trend of HIV spread globally. We are winning the war.
Women living with HIV in Nigeria, as well as activists, also celebrate the fact that prevention and treatment programs have yielded positive results, and that the greater sense of awareness around HIV has served to demystify the disease.
1999, when I tested positive, it was, should I say, a really thought of war, because you don't want to be known to be an HIV positive and nobody wants to come close to you. And at that time, there is this skeleton they draw that said, once somebody look like this, the person is HIV positive. So the stigma that time, it was very high. At a point, my reverend that got to know that this is exactly what happened to me was like telling my dad, happens to be the senior elder of the church, said they should take me and put me in a place where people like us die and go. But when you look at that time and look at now, there is a lot of awareness, there is a lot of advocacy, there is a lot of treatment, because then there was no treatment.
I didn't know that I actually have a right to, talk back at the doctor when the doctor is actually saying something that is not favorable to me and actually trying to diminish my person as a person living with HIV. Because I remember those days then, before now, I remember going for an audition because I aspired to be an actress. So I went for an audition. I was casted to play a role in a movie. We traveled, and then when I came back, the doctor was just yelling at me in the hospital then. He was just yelling and saying, why would I leave my appointment? Because my mom actually went to the hospital to take my medication. So that was how he knew that I was not around. He was like, why would I go leave the town just to do some other things, that I'm not putting my life first, I'm not putting my health first. It made it look like the whole thing is such a big deal that I'm just subjected or imprisoned to coming to take medication, even if I have something else, that I want to do, like work-based. And I was like, okay, is it something that I'm not allowed? Like, I don't have the freedom to go about my everyday life because I am taking ARVs or because I am on ARV medication. So it kind of diminished my person. I kind of felt really, really down, and not like I'm not a human being and I'm not supposed to take decision about my life and future. But then after some time, when the project came in, I get to realize that I have right to speak for myself. right to make decisions for myself, right to my sexual reproductive health rights services, right to be who I want to be, you know. And then at some point, when I went back to the hospital, I had this courage in me. I became this bold and confident that if any nurse speak to me in a very rude way, I would just reply the person and tell the person this is not how it's supposed to go.
The collective effort of pressure groups like ICW West Africa, other non-governmental organizations, as well as state actors and healthcare providers may have helped to keep HIV at bay in Nigeria. But many challenges still impede the consolidation of the successes so far recorded. These challenges include stigma and discrimination, which have constituted major barriers to HIV testing, treatment uptake, and drug adherence.
Most of the times in the community, we have cases of unwanted pregnancies and unsafe abortions, and there are times when we have to refer these cases to health centers, and when there is an adolescent girl involved, there's always this judgmental look, and you're a small girl, how could you get pregnant? You are this, how could you go for unsafe abortion? How could you do this? And most of the time, I just feel like these things are preventable if adolescent girls have access to either sexual reproductive health information and the services.
Like Unimed Akure, specific, I will still say it, and I can say it anyway. For years now, since 2011, I started working in that hospital. We have a separate labor room for PLHIV. We have a separate bed at the antenatal ward and even the postnatal ward. The last 4 beds, as in 2 at the right-hand side, 2 at the left-hand side, that is for the PLHIVs. You don't need somebody walking into the ward. You don't need anybody to tell you these are the set of people for HIV because they are beside the toilet. But not until ICW came into Ondo State. We are all happy. The women in Ondo State, the PLHIV in Ondo State, they are all happy right now. Because they came down and break that yoke and make them understand PLHIV, they are not slaves. They are also human beings. They should be treated equally as other human beings.
We did a documentation of about 30 women. And among these 30 women, 6 of them have lost their family because of disclosure of status to their husband or to their partners by healthcare provider. So we use this evidence to also engage and sensitize the healthcare providers to say, this is what is happening in the healthcare in your facility. In providing services for women living with HIV, we need to be sensitive to this. Otherwise, it will reverse the gains that we have made collectively in the past years. So this is also another area that I think we have achieved. Then the other finding has to do with the use of elbow-length hand glove. In one of the facilities, women living with HIV were asked specifically that they should come with elbow-length hand glove during delivery. In fact, the other women that are not living with HIV, they also bought elbow-length hand glove. And the nurse would tell them, are you among them? The woman said, what? I said, are you living with HIV? It's only women that are living with HIV, we ask them to come with elbow-length hand gloves. So we engage with the healthcare providers to say, okay, they should try and embrace the principle and the tenets of universal precaution. Actually, elbow-length hand glove is for a special procedure, whether a person is living with HIV or is not living with HIV. And that has also been addressed now.
We need to also start restructuring our healthcare system around HIV and AIDS to ensure that those services are integrated into our normal healthcare system. If someone comes for malaria, offer them a HIV test. Those are the basic things we need to start doing within our restructuring our healthcare system and the perception of our healthcare workers towards things like that. So that is a challenge that, if not addressed as well, can lead to unfortunate effects.
One of the campaigns of ICW West Africa is for the Nigerian government to take ownership of the HIV programs, as poor domestic funding is a major threat to the gains recorded so far in HIV prevention and treatment.
Our aim was to ensure that yearly we have up to about 50,000 of Nigerians that we should be enrolled into the program to know their status. We know that we have a challenge, and we are still prioritizing the testing because of shortage of test kits, which the country is still working to ensure that we have enough test kits. Because over the years, you look at it that the support from the partners is dwindling, and they are not supporting it the way it used to be. So it's also affected the program that. But government is working up now to ensure that we procure all those test kits to meet up with the target that we are setting to ensure that we have a good coverage in terms of testing and people knowing their status.
As we speak, the amount of money invested in this one country, Nigeria, by a global fund may be approaching $4 billion. PEPFAR, the same amount. So the problem is not so much the investment by the external communities, by the donors. The problem is the investment by the governments.
Going forward, what we're looking at is getting government to scale up. And this scaling up is both at the center and at the state level. Especially at the state, we want the state to take ownership of the program. With all the support that is coming, state getting the support instead of the central government getting the support, but state being held accountable and the state investing to ensure that this program continues.
The fear and concern of people living with HIV is that Nigeria may not be able to meet basic testing, treatment and drug adherence needs if and when international donors quit. Already, HIV services in Nigeria have reduced to just antiretroviral drugs and viral load testing, and the scope of activities of civil society organizations like ICW West Africa have been narrowed due to dwindling resources.
We have a lot of volunteers, pool of volunteers who have trained already under the project, under the coalition. Many of them are scattered in different facilities and they are not being supported. So we are advocating, our own is that for them to remain there, because at times we'll support them with some token to keep doing what they are doing, what they know best how to do. But as the project is ending, it's also a big threat now because they may not be having the support to continue. When you are HIV positive and you to even get pregnant also is a very big risk. But we know that even prevention of mother-to-child transmission goes a long way in ensuring that the baby is not HIV positive. So these our Shiwi coalition members, they are not just only advocating for SRHR also. Many of them are like mentor mothers at the facility, ensuring that no child is being born HIV positive. They stay there, they play a vital role.
Most of the things now is being introduced in the facility. Something that we have not been paying since 2006, we start paying them now because the fund, they are trying to withdraw back. So what we are saying that the government are not putting more in terms of treatment and in terms of other opportunistic infection like STI, the rest, they are not putting more money because when I have opportunistic infection, I'm being asked to pay from my pocket. And paying from my pocket, that opportunistic infection is so expensive. And sometimes we don't even have it. Talk more of the consultation fees that we are paying now in the hospital because if you are going to see a doctor, they will ask you to pay consultation fees. And you can imagine me being infected and I have a child that is also infected. I'm paying for my child consultation fees. I'm also paying myself for consultation fees. And some hospitals are so crazy to the extent that if you didn't pay that consultation fees, there is no way they can attend to you and you have to go back without your medication.
No doubt Nigerians, especially members of the Shiwi Coalition network of ICW West Africa, will like to see a greater will on the part of the government to take ownership of the funding of HIV programs in the country. Because this is the only sustainable way to consolidate on the gains that have been recorded so far.
I would like to see our government allocate more funding for HIV and AIDS intervention for adolescent girls and young women when it comes to SRHR. Because this project has really helped a lot of people, most especially a lot of young girls like me. We now know our rights. as a person living with HIV, and we now know our link with SRH services, you know. But then other people out there, you know, because I learned the project, worked in different, like, other states, but then there are many more states to be, you know, worked on, and then many more works to be done.
Bye.